Common injuries from exercising usually involve the neck or the back, and our guest today is a certified spine surgeon. Here today is Dr. Rad Payman, who can tell us how to avoid injury and what to do if you're already experiencing some discomfort there. Good morning to you.
Morning.
Welcome.
Nice to see you.
You too. Okay, a lot of people starting off this new year with resolutions to get back to the gym. I'm going to get it bigger, stronger, but that could be dangerous, right?
It can be. And you know, neck or back pain occurs quickly, often when lifting heavy objects or twisting or bending awkwardly. So it's no surprise that people that incorporate exercise, workout, or participate in sports can experience neck or back pain, especially when starting a new workout, much like all the New Year's resolutions we promise that we're going to start. So it's great, but it can be dangerous as well.
What are some common things that people do wrong that end them going back to the doctor for help?
You know, I think it really comes down to awkward motions, and there's the main activities that cause neck or back pain are lifting things that are too heavy, number one. Number two, bending or twisting awkwardly at the waist. So a lot of these new workouts you hear about CrossFit or grabbing a kettlebell while balancing yourself on a ball.
Oh my goodness.
These look great. So I go to the gym all the time and I see all these new exercises and I'm like, wow, let me try that. But you realize it's just not really the best thing for your neck or your spine in general.
Well, kettlebell ball, doing that while on a ball, that seems a little too crazy.
Exactly, but it looks great.
Yeah,
but
that's true.
It's just really puts your spine at risk for injury.
Yeah, so you brought a model here to kind of display what is kind of happening inside the body, right?
Right. So most neck or back pain that we experience is soft tissue. And what does that mean? That means it's a muscle or a ligament, sprain or strain. Typically that goes away after a couple days of rest, over-the-counter medications. You're fine, you start exercising again, and we encourage that. It's when the pain lasts several weeks and doesn't go away with rest or over-the-counter medications that we start to get worried, and that's usually when it's a disc issue. And the disc is a soft tissue cushion that's between the bones in our spine. This is a model of the low back, so we see the front, side, and the back of the spine. Again, we really focus on the discs. When the disc or the soft tissue or cushion between the bone becomes injured, it can herniate and go back and start irritating the nerves and the spinal cord going down the center of the spine. That's usually when the pain starts to be associated with numbness or weakness in the arm or leg.
Okay.
That's when you need to really stop that activity and consult with a specialist to see what's exactly is going on.
Yeah, Dr. Payman, thank you so much. Great tips right there. I'm sure you have plenty more that you can talk about. Of course, if somebody out there might be having a problem, how can they reach you?
They can reach us at thespinemd.com or 818-501-2001.
Okay, you're based in the Los Angeles area,
Correct.
Right?
Correct.
Okay, well there we go. Thank you so much for joining us. There you have it. Some tips on how to prevent that from happening, and if it does happen, they know where to go.
Exactly.
All right, thank you so much.
Nice to see you.
You too. Have a great day, everybody. Be careful out there, and we'll see you tomorrow.